Hello, and thank you for joining us today. We'll be talking about the facts about prediabetes and how you can prevent or delay type 2 diabetes. Some of the topics include what is prediabetes, what is diabetes, what you can do about it, and what steps you can start taking today. All right, let's get started. The goal of these sessions is to provide resources so that you can review the material on your own time and in small steps. The website will offer 3 sessions about prediabetes and taking small steps to create healthier habits to prevent type 2 diabetes. Each session will be broken into 4 to 6 minute information pieces. This way you can go at your own pace. Some people like to go in order, others like to jump around by topic, and then sometimes you may listen to a few sessions and then come back in the next day or two and listen to the rest of the sessions. Our goal is to meet you where you are and at a time that works best for you. The program is set up into 3 separate sessions so that you can learn some information and then implement some of the changes that you want to make, and then to come back about 4 weeks later, and then you can review what went well and what you'll do differently for the next 4 weeks. In the second and third sessions, we'll provide additional tools to help you implement some of those small steps to prevent or delay the onset of type 2 diabetes. In session 1, we'll cover what is prediabetes and why it's important. We'll discuss the risk factors for prediabetes and diabetes. We'll also take a few minutes to talk about what the blood glucose or blood sugar values mean when your medical provider refers to those numbers. And then lastly, we'll talk about what you can do now and the steps you can take to prevent type 2 diabetes. First of all, let's discuss what is prediabetes. Prediabetes is a health condition when the glucose in your blood is above the normal range, yet not so high that you're diagnosed with type 2 diabetes. But blood glucose is also known as blood sugar. You may have heard both terms. For the sake of simplicity, we'll use the term blood sugar. Some doctors may use different terms for prediabetes. It's not always easy to share this information with a patient. So you may have heard a medical provider use the term borderline diabetes, a touch of diabetes, or maybe just a little bit of diabetes. Remember that prediabetes means that your blood sugar is higher than normal, and that if you continue on the same path, you greatly increase your risk of developing diabetes. Saying a touch of diabetes is like saying you have a touch of pregnancy. It doesn't really make sense. Many people don't know that they have prediabetes. The Centers for Disease Control estimates that almost 84 million Americans have prediabetes. And out of that group, almost 90% don't realize that they have it. This may be why your employer or your health insurance company encourages you to have your labs run each year when you meet with a medical provider to help raise awareness of your health status. If prediabetes is diagnosed, the next step is to create healthier lifestyle habits. Why is this important? Sometimes patients ask us this question. They say that it seems everyone has prediabetes, their family genetics played a significant role, and they feel that there's little they can do to prevent type 2 diabetes. Our response is this: it is important. Prediabetes is a serious health concern. You can take steps today to reverse or delay the onset of type 2 diabetes. Having prediabetes does increase your risk of developing diabetes and other heart diseases. Also, if the disease progresses and type 2 diabetes does develop, it increases the risk of serious health complications, including blindness, kidney disease, and heart disease. At this point, there is no cure for diabetes. So our goal is to work together and to provide you with information, resources, and tools to help you prevent or delay the development of type 2 diabetes. So now we do know that prediabetes is important. So imagine that you're at a fork in the road, and if you continue on the same path that you've been on, that right-hand path, that some of the choices that have been made will increase the risk of developing type 2 diabetes and all those health complications that we just discussed. So instead, choosing that left pathway, it's a different pathway. It does involve making some new changes, but it can lead to either preventing or delaying the onset of type 2 diabetes. We know that making lifestyle changes may pose new challenges, like carving out time for activity, changing up meal plans, finding new recipes, new food items in the store. But many people find that these changes are easier to make than the changes needed once they did actually develop type 2 diabetes. So we have a saying that we like to use in the Office of Wellness, that an ounce of prevention now is better than a gallon of treatment later. And taking that left pathway is the first ounce of prevention. Thank you for watching part 1 of Just the Facts About Diabetes. When it works for you, please return and watch videos part 2, 3, 4, and 5.